We started the session with a simple question. People are sometimes confused. What is the difference between a palliative care or supportive care consultation and a geriatric assessment? And we reviewed the literature. And supportive care consultation or palliative care consultation will be primarily focused on symptom management and goals of cancer care and coping strategies. A geriatric assessment has a broader spectrum of looking at the cancer within its context. The cancer within the other health problems the patient may have, the cancer within the other functional needs, nutritional needs, and other needs the patient might have. Well, sometimes the cancer is not the major problem of the patient, and they may have other health problems that are actually predominant. And so the symptom may not be due to the cancer, they may be due to other reasons. So we have to sort that out carefully and make a plan of care that is comprehensive. The Tamil study, the famous study where they showed that early palliative care in lung cancer was improving survival, they did publish this year an analysis where they showed it works in younger patients, but in older patients the effect is lost. And why is that? It might be that indeed all these patients also had other problems that may or may not have been addressed in these visits. So that's where the geriatric assessment can bring things. I think the common message of all the speakers in that session was that you need to look beyond the cancer in that patient, and you need to do a correct screening for geriatric problems. It can be a very short screening, it can be a 5-minute questionnaire done by a nurse with the patient, or it can be a more complex intervention if the questionnaire is positive. The demographic answer probably starts around 70, 75. This is when, as a group, people start having multiple health problems, and there is a bend in the curve of the number of problems that happens somewhere in the 70s. Not everybody who is 70 is in poor condition. So you have a lot of people, Senator Glenn, when he went on the space shuttle, was 77, okay? So you have to sort out the individual health of the patient, and you have to individualize the plan of care, and that's what the geriatric assessment is supposed to bring to the table of the discussion. One of the challenges is that quite naturally the oncologists and the family tend to attribute every symptom to the cancer or its treatment. And it may not always be the case. I had an example of multiple myeloma patients who kept losing weight, and I couldn't find why he was losing weight. We tried various things, and finally we discovered that it was because his dentures were not fitting. And once we sent him to the dentist, he was much better. I think as far as giving proper supportive care to the patient, when the patient is an older patient, you need to do a geriatric screening, and you need to at least be aware of the other problems the patient has. Even if you are very busy, even if you have few resources around, you only treat what you find, and therefore at least screen for things.